phalangeal junction. You can see that there's a biopsy tract there, so it's been previously biopsied as a grade 2 soft tissue sarcoma, and it's had thoracic radiographs, and those were clear. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. So in this one, I'm going to do, because it's on an extremity, we can do somewhat more limited margins. And so I'm probably just going to go about a centimeter. So going a centimeter around the base of the mass. And then we have the option available, if I'm concerned about the completeness of my margins in surgery, to do electrochemotherapy at the same time. So we've got the electrochemo machine here, we've got the bleomycin ready. So I'll start my incision. I see that there's a big dorsal metatarsal vein that I'm about to go over right here, so I'll have to be careful and ligate that. That's going to be about 5 or 6 millimeters in diameter. So I make my initial skin incision with the blade, and the rest I do with cautery. And then just note that in this location, I am going to remove the extensor tendons, and there's absolutely no problem with removing extensor tendons in a dog. So we are getting a little bit of pullback on the leg. We did a ring block, but I don't know if it's completely taken. Heart rate, is that coming up at all? Or no. I might be just getting some nerve.
Everything's stable.
Yeah, I might be just getting some nerve reaction. So I'm going through the extensor tendons right there down to the metatarsal bone. And just if you're watching, can you just let us know where you're watching from?
Your head's in there.
Whose head?
Your head.
My head? I am a surgeon, so I do have a big head. They had to widen the doorways when I came here. Still in the way?
No.
So where is this vein here?
It's in the way.
My head?
You're the only head that's in the way. Still in the way.
Oh my gosh. Now let me grab another hemostat. Alright, so I'm just dividing that vessel. Coming around the side here. And I am going to leave this open to heal by second intention. See if that will come up yet.
How do you deal with the smell, too?
You get very used to it. And so there's a question in-house about how we deal with the smell of the electrocautery. Brings up another issue, which is whether there's an issue with inhaling the smell. And there have been some studies that have shown that the smoke is carcinogenic, but it's in very large quantities. So if you smoked basically a gram of tissue in a pipe, you'd get the same amount of carcinogens as in a single cigarette. And number one, I don't think we come anywhere close to vaporizing a whole gram of tissue. Number two, surgeons don't have an increased risk of nasal cancer. And I would think that given the number of surgeons that are basically smoking vaporized tissue, that if there was an increased risk or if it was significantly carcinogenic, that you would see an increased likelihood of nasal cancer. So I've never really worried about it too much. There is a tendency now to aspirate the smoke, but again, that's just based on a hypothetical risk. Can I get another hemostat? I've got these little guys here. It's got these little interdigital vessels. Do we have any questions up yet, Marnie?
We have one in Spanish,
Yeah?
but then there's another one from Arturo asking, what do you think about using a tourniquet in this type of surgery?
So using a tourniquet in this type of surgery, look, it's not a bad idea. I haven't found it to be terribly necessary, but if you are concerned about bleeding, like I'm just careful with the anatomy. I know the anatomy, and I use generous use of electrocautery.
Your head in the way too.
Generous use of electrocautery. I find that the hemorrhage that I see is not very significant. A little sesamoid there. All right, so that's the underside of the mass. I'm just going to have a look at it to see if I'm confident with my margins. We can see that the tissue is moving easily over the tumor, and so I'm pretty happy with that. We will ink those margins to...
Yeah. Did you want electric chemo?
No.
No?
No.
Where do you
So
want that sent off to, sorry?
IDEX. Yeah, so you can see here that we've got an open joint here, which doesn't matter. Again, that'll just granulate in. I've got a vessel that I need to ligate there. Can I get some 3.0 PDS, please? I do have some people that I scrub with who have a preference for suctioning the smoke, and I obviously don't have any problem with that. Okay, release that slowly, please. Okay. So my next case today is a pancarpal arthrodesis, which I will also be live streaming, so just stay tuned. Probably starting that in about an hour, 45 minutes or an hour, something like that. Now, the other issue with these is that rebleeding can be a real problem. What happens is that you bandage them, and then overnight, all of a sudden you get a strike through of blood through the bandage, and somebody has to change that bandage, and if it's a bad bleed, then somebody has to find that bleeder. And we don't have a vet here overnight, we only have a nurse, and so that's a real challenge. So I'm just being really cognizant of all of these blood vessels. And then I'll go back over and just make sure that I don't have any obvious bleeders. Can you release that slowly, please? And these vessels would be too big for electrocautery. Probably we could do it with ligature, but in a mass this big, using ligature is possibly overkill. So let's just look down here and see if anything else is bleeding. And see how Jacob is just dabbing. He's not dragging the swab across the bed because that will dislodge the clot that the dog is trying to form. All right, so I'm pretty happy with that. Now, the other question often comes up is, do I do anything to try to partially close this? And look, usually I don't. If I've got a little, if I've got a little area that I can easily oppose with a suture, you can certainly do that and maybe try to give it a little bit of a head start, but it really, I don't think it makes much difference. If you could take a minute and let us know where you're watching from again.
There are a few more questions.
Yeah, what are the questions?
So we have a thank you so much for these videos. I have many patients that have kept limbs, tank swaying, have learned this technique and flat techniques from your videos over the past few years.
That's nice, thank you.
I'll just quickly scroll through. So we have Philippines, India, Idaho, California, Mexico, Hong Kong, Romania, San Jose,
California, I assume.
Saskatchewan, Canada,
Yeah.
more Philippines. There's a question asking, not related to this case, but they have a cat with a metatarsal foot pad squamous cell carcinoma. They're doing a salvage procedure by removing the entire affected foot pad. And we have someone from Portland, Melbourne, and there was a question, do you just use lidocaine or bupivacaine in your ring block, or do you add any analgesia?
So it would just be bupivacaine in the ring block. That's going to give us about 8 hours of pain relief, and what I find is that even if technically the drug only lasts for 8 hours, that we get really good long-term pain relief because you never get wind up.
Someone's mentioned that there are vapor suction that you can get with the laser machine.
Yeah, if we have one of those for our laser, but the vapor suction, but it's hard to sterilize.
And we have people from Arlington, Korea, Knoxville, Cancun, and India.
Cancun.
Texas.
That's a good variety of people watching.
And someone had a stuffy that had a muscle tumor removal a few weeks ago on his hip and is doing well.
Correct. All right, so let's see what we've got here. A little bit of a bleeder. Okay, we'll just tie that guy off. So we just found another bleeder, actually got a little rebleed, and that's one that if we had not tied that off, that we would have had strike through from the bandage, and either I would have been called back in the middle of the night, or go ahead and release that.
And apparently there are some questions on the Vet Online chat. And we have someone watching from Egypt, Costa Rica, Wisconsin. And what protocol do you recommend after surgery to prevent any possible metastasis?
So with soft tissue sarcomas of the extremities, metastasis really is not an issue. So it's been shown also that chemotherapy in the form of adriamycin or doxorubicin does not prevent metastasis of soft tissue sarcomas. So if you had an owner that was really, really dedicated and really wanted to do absolutely everything possible, you certainly could do something like doxorubicin chemotherapy, but there certainly isn't any evidence to prove that it's going to be of benefit.
We have someone from Chile. Then we have a question from Adrian asking, hi Dr. Charles, silly question. I have seen that the human doctor surgeons that remove tumours in the brain use something like a cotton ball soaked in hydrogen peroxide to kill tumour cells, or for another reason.
I'm not familiar with that. I would be concerned that hydrogen peroxide would be toxic to the tissues. So it's not the first thing that I would reach for.
We have you bandage this wound through the inflammatory phase until it granulates, or leave it from day one?
So we bandage it from day one until it's healed at about 8 weeks. Can I get some more 3O PDS, please? Are we bleeding again?
There are a lot more questions.
Thank you.
So we have a question, do you ever do or offer free skin grafts at the same time post-op? I've seen some studies showing it can be somewhat of a decent option as opposed to doing it later when granulation tissue forms.
So I have read those studies that suggest that you can do free skin grafts at the time of the initial surgery. I have found that to be unsuccessful in a lot of cases, not in a lot of cases, a few cases. And so my tendency, given that skin grafts are not that successful in animals anyway, that I tend to use second intention healing as my method of choice.
And we have a question from Garcia asking, do you have the opportunity to use tilapia skin on wounds?
So tilapia skin is fish skin. That's not something that's available in Australia to my knowledge. I know that there's been some evidence that it brings growth factors in and can be helpful, but it's not something that I've used.
And we have someone just tuning in a bit late to the surgery asking if this was diagnosed by histopath or cytology.
So this was diagnosed by histopathology. So they did a proper biopsy and got a grade 2 soft tissue sarcoma.
And we have a question asking, in this case, why don't you use an advanced skin flap and opt for second intention healing?
So the skin flap that we would use would be a reverse saphenous conduit flap from the medial aspect of the leg. And look, would it reach here? Possibly. It's a little bit far. That's really the only one that's available to this location. And I am a big believer in keeping things simple. And so I've just had so much success with second intention healing. And I know that it does require bandage changes and stuff like that, but I just think it's such an effective method that that's my method of choice now.
And we have a question, how frequently do you change the bandage and do you apply anything to the wound before the bandage?
So I do not apply anything to the wound. I just use a dry, non-adherent melalin pad, and I change the bandage every 3 days for about 2 weeks until we've got granulation tissue, and then I change the bandage every 5 or 6 days until it's healed. A wound like this will take probably about 6 weeks to heal. I'll get one more.
And there's a question, will you proceed with wet to dry bandages for the wound healing in this case?
So wet to dry bandages are only necessary when you're trying to debride an infected wound. Because this is a sterile wound, all you need is just a non-adherent bandage. Now, if this had been a traumatic wound and there was gravel in it or necrotic tissue or something like that, then a wet to dry would be perfect.
And there's a question asking, would you use, it says Manila honey, but I think they mean Manuka honey.
So Manuka honey is not indicated in sterile wounds because they've shown that in sterile wounds, Manuka honey actually impedes or delays wound healing because it's too thick a medium for the fibroblasts to travel through. So that, again, if it was an infected wound, like a road trauma or a bite wound or something like that, then Manuka honey would be great, but not in a sterile wound. And can we get some of that nice new white tape and bandage material?
Yes.
Thank you. So just zoom out here. We'll show you how we put a bandage on. Any other questions? So another question.
Charles, I got a question for you. Being someone who's come in today and just seen what's going on here with your, I call them students from all over the world.
Yeah.
Why did you decide to do this and offer this for everyone to see?
So I kind of happened upon live streaming about probably 6 years ago, just by mistake. Not by mistake, but I had been doing edited videos where I would record a 1 hour surgery and then edit it down to maybe 7 minutes and narrate it. And fundamentally, I'm a pretty lazy person. And that editing process just is so labor intensive and takes so long that I happened to see one day that there was a button on the YouTube channel that said I could live stream. And it was amazing because I didn't realize how many subscribers we had. But the first time I pushed that button to live stream, we had, can I get Nolan, please? We had about 50 people watching from 17 different countries, and I had never live streamed before. And so, being the compulsive person that I am, I got this huge dopamine rush at the fact that all these people, we were helping all these people and getting all these viewers. Can I get cotton, please? That I just thought, what a great opportunity to, I guess the corny term for it is to give back, but to make an impact on, the tens of thousands of vets and the hundreds of thousands of animals that don't have access to specialists because of geography and economics in the world. And so by doing this, we're allowing, can I get some clean, please? We're allowing vets who, a lot of whom never had specialists to even scrub in with when they were in vet school, to have access to me, or to specialist vets. I think my original idea was that we'd have a bunch of people doing this, but had a little bit of interest, but not a lot. But to have access to a specialist and to actually be able to ask questions and get clarification on things that they learned in school or that they read in textbooks, just to help them do a better job. And we have vets that are even like doing spinal surgery in India that learn just from the YouTube videos. And I'm not saying that that's the perfect idea, but there was nobody else at the time doing spinal surgery in India, and that's 1.5 billion people, and all these dogs that were permanently paralyzed because there was nobody that could operate on their ruptured discs. So that's been a real motivation for me to see that there are people actually doing surgeries that maybe weren't even available in their geographical area.
And there's a question of, do you use calcium alginate?
I don't use anything on the wound except for a dry gauze. And I haven't seen, a lot of evidence that shows that it makes a huge difference. And I just find the simple technique of just using dry non-adherent bandage to work as effectively, if not more so, than anything else I've used. All right, so that's our bandage there. And just come over to the screen and make sure. So the non-adherent bandage is called Melolin. Melolin, spelled M-E-L-O-L-I-N. That's the Australian product. So regarding the access or exposure to the joint, there's a question about how long it takes for that to heal. Granulation will be sealing that up probably in about 2 weeks. And I've done that many times, never had an issue with it to my knowledge. If I found the wound was infected 2 to 3 days out from surgery, Ideal would be to do a culture, and depending on how infected it was, to do a culture and then possibly do a wet to dry bandage overnight. So the wet to dry bandage would just be wet gauze on the wound and then a normal modified Robert Jones bandage over the top of it. And then change it in 24 hours. Very likely that wound would be significantly cleaned up, and then you can go back to the non-adherent. So cats are a different animal. So cats do not heal by second intention very well, and so I'd be more likely to do something maybe like an axial pattern flap or something like that in a cat than I would be in a dog. All right, so I think that's pretty much it for questions. If haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. And we will see you hopefully in another hour or so with a pancarpal arthrodesis.
Perfect. Oh, that was hectic. There was so many